Scenario: footballer had a right knee injury years ago, had a knee operation that he has no idea about, and developed worsening right knee pain 1 month ago. Introduce yourself and take permission. Hello. I am Ali, one of the surgical doctors working here. May I confirm your name and age, please? My name is Adam. I'm 56 years old. Nice to meet you, Mr. Adam. I will be your doctor today. Is that okay with you? Yes. Go ahead, doctor. How can I help you? I have pain in my right knee. I am so sorry to hear that. Don't worry, you are in safe hands. Analyze the main complaint using Socrates. Site, onset, course, duration, character, radiation, timing, severity, aggravating and relieving factors, and associated factors. Where did you feel that pain? Could you please point to the site? The pain is mainly in my right knee. Points to the right knee. It's been bothering me a lot lately. Does it move anywhere? No, the pain stays in my right knee. It doesn't seem to move to other areas. When did you first notice that pain? Did it start suddenly or gradually? I first noticed the pain about a month ago, and it started gradually. It wasn't too bad at first, but it has been getting worse recently. Did it come and go? Has this changed recently? Initially, it would come and go, especially after physical activities, but recently it's been persistent and doesn't really go away. Is there any specific time during the day that the pain increases? The pain usually gets worse in the evening and at night. Is there anything that makes this pain stop? Resting and avoiding putting weight on my right knee helps to ease the pain a bit. Is there anything that makes the pain increase? Walking or climbing stairs tends to make the pain worse. Could you please describe that pain for me? Is it colicky, cramping, or stabbing? The pain feels more like a deep ache and sometimes a sharp stabbing sensation, especially when I move my knee. How badly is this affecting your day-to-day life? It's been quite challenging. The pain makes it difficult for me to walk comfortably, and I've had to cut back on activities I used to enjoy. That must be hard, Mr. Adam. Yeah, doctor, not a fun thing. If you had to rate the pain from 1 to 10, with 10 being the worst pain you can imagine, how would you rate it? I would rate it around 8. It's quite painful and really impacts my daily life. I deeply understand that. Differential diagnosis. 1. Osteoarthritis. Did you notice any weird noises when moving your knee? Yes, doctor. Did you notice any changes in the shape of your knee? Was there any history of trauma? Yes, I noticed change in the shape of my knee. I had a fall on my right knee several years ago. 2. ACL injury. Did you experience your knee giving away while walking? No, I haven't experienced any giving away sensation in my knee. 3. Meniscus injury. Do you experience locking of your knee? No. 4. Rheumatoid arthritis. Have you noticed any stiffness in your joints when you wake up in the morning? How long does that last for? I haven't noticed significant stiffness in my knee throughout the day. 5. Septic arthritis. Have you noticed swelling of your knee or redness? Is there any discharge? My knee has been slightly swollen, and sometimes it looks a bit reddish, but there's no discharge. 6. Spinal cause. Have you noticed weak or numb legs? Do you have back pain? I haven't noticed any weakness or numbness in my legs, and while I have occasional lower back pain, I don't think it's related to my knee pain. 7. IBD. Have you noticed any rashes anywhere on your body? Have you had painful or red eyes? No, I haven't noticed any rashes or experienced painful red eyes. Did you notice any change in your bowel habits? Ask this Q separately. I have any change in my bowel habits. 8. Malignancy. Have you noticed any significant weight loss over the past few months? How is your appetite? No, my weight has been stable and my appetite is normal. Past medical or surgical history. Did you experience similar symptoms in your past? No. Were you diagnosed with an medical condition? No. Have you had history of surgery before? No. Family history. Is there anyone else in the family who has had a similar problem? Not that I'm aware of. No one in my family has mentioned having knee problems like mine. Drug history. Do you take any medications? I'm currently taking some over-the-counter pain relievers occasionally for knee pain, but no prescription medications. Do you have any allergies? I don't have any known allergies. Social history. Do you mind if I ask personal questions? No problem at all. What is your occupation? I work as a receptionist at a local office. Who is at home with you? I live alone. Do you have any difficulty with the stairs? Yes, I have some difficulty with stairs because of the knee pain. Do you smoke? I used to smoke, but I quit 2 years ago. That good to hear? Congratulations. Do you drink alcohol? I don't drink alcohol. Ideas, concerns, and expectations. Before I go any further, could I ask? Yes, no problem at all. What do you think the cause is? I suspect the fall I had might have triggered this knee pain. What are you most concerned about? I'm worried that it might be something serious. What are you hoping us to do for you? I'm hoping you can diagnose the cause and suggest the right treatment to alleviate the pain and improve my knee function. Don't worry, we will do our best. Systemic review. Start from head to toe. Mention the serious symptoms for any systems. Do you have a headache? No. Any chest pain or SOB? No. Any belly pain? No. Any problem with the Wii? No. Any muscle or joint pain? No, I haven't experienced muscle or joint pains besides my right knee. Anything else you want to add? Not at the moment. I think I've covered everything related to the knee pain. Thank you for providing all this information. We will work together to find the best treatment plan to manage the pain and improve your knee function. If any new concerns or symptoms arise, don't hesitate to let me know. Thank you. I appreciate your attention and understanding. I hope we can find a solution to this knee pain. Discussion. Present your patient. I took a clinical history from a patient. Mr. Adam is a 56-year-old male who reported persistent and worsening pain localized to the right knee, which began gradually in the last month. The pain is described as a deep ache with occasional sharp stabbing sensations, rated around 8-10, impacting daily activities and increasing in intensity during the evening and at night. He has a history of right knee injury several years ago. Patient have stiffness and neurological symptoms were not observed. What are your differentials, diagnoses? Traumatic osteoarthritis, meniscus, injury. ACL, anterior cruciate ligament, injury. Rheumatoid arthritis, septic arthritis. Referred pain from the back, spinal origin. Inflammatory bowel disease, malignancy. How will you investigate your patient? I will start by doing full clinical examination of the knee joint. Then I will request imaging. Weight-bearing, knee x-rays, AP, and lateral view. MRI, magnetic resonance imaging. Evaluate soft tissues, ligaments, meniscus. Blood tests, FBC, inflammatory markers, ESR, CRP. Joint aspiration. Rule out septic arthritis. Analyze synovial fluid. How will you treat your patient? Conservative management, analgesia, heat application, achieve and maintain health weight. Regular exercises, assistive devices, braces or orthotics. Medical interventions, intra-articular steroids injection. Surgical options, arthroscopic arthrocentesis, realignment, osteotomy, total or partial knee replacement for severe cases to address damaged tissue, ligament repair, or removal of loose bodies in the joint. Thank you, doctor. You can proceed to the next station.